For a third consecutive day, the country's overall daily COVID-19 infections were reported in the excess of 3,000 yesterday. According to the Epidemiology Unit, 3,547 COVID-19 infections were confirmed in the country. The Colombo district once again topped the list with 800 cases, while Gampha confirmed 617 infections. 297 cases of the virus were reported from Kurunegala, 280 from Kaluthara and 278 from Galle. Meanwhile, the districts of Kandy, Mathale and Mathara reported 172, 118 and 109 new infections respectively. A further 867 infections were reported across 17 other districts. 9 imported cases were also included in yesterday's daily COVID-19 count. As for today, 2,145 new COVID-19 infections have been reported so far. In the meantime, Deputy Director General of Education and Research at the Ministry of Health, Dr. Hemantha Herath, today defended concerns raised over the efficiency of the Epidemiology Unit in dealing with the pandemic.
Compared to many other countries, we have achieved much more results, and main contributor for this success was the epidemiological unit. They were the people who were ready to face the initial phase of the epidemic and to provide the necessary guidance to the health ministry and all other stakeholders, and managing the epidemiological aspects of the epidemic. And collection of data was carried out initially with the limited number of staff available, but gradually the number increased and the amount of data collected and stored and analyzed in that unit increased, and that reflects in the website of the epidemiological unit, where initially we had very small amount of information, but nowadays we can see that many new information, new analysis is being done, and these are available on a daily basis, weekly basis in the website. And also sometimes people are expecting certain information on a daily basis, which is not practical. For example, the daily death analysis is not realistic because certain deaths are confirmed few days later, and as a result the Ministry of Health and the Epidemiological Unit is still giving the same analysis on a weekly basis.
Meanwhile, Dr. Herath also explained as to why certain information isn't published and made readily available to the public.
There can be certain information that is either not available in the epidemiological unit or not readily available in the epidemiological unit, because certain specific information, even though the information is collected, unless there is a specific need for the decision making, sometimes all this information is not analyzed, processed and taken into specific platform. Basically, at a given moment, it is important to identify the vital information for decision making. So, if somebody is requesting some information that was not routinely used for decision making, sometimes it will take little time to get this information. So, that is the reason why most of the time certain information is not available on time. But if somebody needs any information, please contact the epidemiology unit or the Ministry of Health. We will do our best to provide that information.
In the meantime, the rare black fungus, also known as mucormycosis, has been widely reported in many states in India, predominantly in COVID-19 patients. It now transpires that a similar case is found on Sri Lanka's soil, with a patient diagnosed with black fungus from Ampara.
ඉන්දියාවේ ලැබෙන තොරතුරු ඉතාමත්ම භයානකයි. මොකද දිලීරය හරහා මේ රෝගී භාවය නැත්නම් මේ රෝගී තත්ත්වය උත්සන්න වීමට ඒ වගේම මරණ සංඛ්‍යාව වැඩි වීමට හේතු වෙලා තියෙනවා. කොවිඩ් වෛරස් එකත් තමයි කොයි ආකාරයෙන්ද සම්බන්ධ වුනේ කියන එක මේ වෙනකොට ඔවුන් සොයා බලමින් පවතිනවා. ඒ සම්බන්ධයෙන් පරීක්ෂණ කරමින් පවතිනවා. ඉතින් අම්පාර ප්‍රදේශයට ඒක කොයි ආකාරයෙන්ද ගියේ කියන එක තාමත් ගැටලු සහගතයි.
In other developments, State Minister of Primary Healthcare, Epidemics and COVID Disease Control, Dr. Sudarshini Fernandopulle, sent a letter to the Consul General of Sri Lanka in Australia, Lakshman Hulugalle, requesting to be provided with medical equipment necessary for providing oxygen. A list of about 2,500 medical equipment, including oxygen machines, which the letter says are currently in short supply at hospitals in the northern, eastern, Kegalle and Gampha districts, have been requested. In other developments, the second dose of the AstraZeneca vaccine was given to 6,497 people yesterday. The total number of people who received the second dose of the vaccine is now 320,196. Meanwhile, the Ministry of Health stated that 16,120 were given the first jab of the Sinopharm vaccine yesterday. A total of 501,493 people have received the Sinopharm vaccine so far. Meanwhile, Sri Lanka reported 44 COVID-19 related deaths yesterday, making it the highest reported daily count so far. According to the Department of Government Information, 23 victims were over 71 years of age. 11 victims were in the age group of 61 to 70 years, and 7 were aged between 51 and 60 years. 2 victims were 40 years old, with 1 victim being a 22-year-old. COVID pneumonia and complications from chronic diseases such as diabetes and heart disease have been recorded as a common cause of death. In the meantime, a total of 1,635 COVID-19 patients were confirmed to have recovered from the novel coronavirus today. That brings Sri Lanka's overall recoveries to 126,995. The island also has 32,351 active COVID-19 cases.
දසනකාන්තී චූර්ණය සහිත ලීවර් ආයුෂ් දන්තාලේපය දත්වල ඇති ප්‍රශ්න 10ක් වළකයි.